Here we go. I'm probably going to get a lot of physical therapists mad when I talk about this exercise because it's such a staple in the physical therapy world. And as I talk about this, please keep in mind that I did try for 2.5 years to get into PT school, and in that process got 150 observation hours. And any knee surgery, any knee pain, any kind of like hip issue, right away is okay, do 50 clamshells each side. And the reason I don't like this is because I'm basically in a seated position, okay? So if I'm here sitting down, all this, all my hip flexors are really tight, and I might even be hunched over. And I've talked about how, tight hip flexors and being seated for so long can be bad for you. Okay, now if you think about that and you put this band around your knees and you become really balled up in a more flexed position here, and now you're trying to strain out your hip flexors with this resistance in a balled up position, that's just really bad for all of this, okay? So what I want to point out is a different exercise. I'm not saying get rid of that, but you got to counteract all that hip flexion, all that external rotation. And a good way to do that here is to grab a medicine ball, kind of flare your feet out, okay, and you pinch the ball between the knees, because now look, my knee's turning in, my hip is actually internally rotating. Okay, so I'm going to squeeze as tight as I can, and even here you can pulse it, do whatever you like, but you're going to squeeze tight on this, and then you're going to activate your glutes now instead of being hunched in a hip flexed, almost fetal position. Now I scoop my butt under like a dog in trouble, right? Scooping his tail between its legs. I start to pinch my butt up as I come up here. Okay, so now I got hip extension, glute activation, hip internal rotation activation with a little, like, you think of this as resistance because if it was a really soft ball, I wouldn't have to squeeze as hard. So you could use a more dense ball to squeeze harder, or a heavier medicine ball because then you would then have to squeeze harder so it wouldn't fall. Okay, and you could just do a whole bunch of hip thrusts, hip raises, however you want to call them. But like I said, the big key here, keeping the feet out so that way your hips can fall in, which would cause the internal rotation. And once you've done that a few times, what I like to do is when I come up here, activating my glutes, extending my hips, I can actually drop in as much as I can with this leg. This is more just my post now holding me up, okay, keeping that glute driving. And I could drop my hip for some deeper internal rotation. Come up and over to the other side now. Okay, keeping the glutes activated the whole time. Roll it down. And there you go, guys. So give that a shot, activate your hips, and let me know how you like it.